To you, Your Excellency. And may this be the beginning of greater things to come. May God bless our nation, Ghana. May we all obey the command of our Lord Jesus Christ when he said, "This is my command, love one another. Greater love has no man than this, that a man lay down his life for his friends." John 15:12 and 13. On this note, Your Excellency, I thank you again. And may I humbly ask, that members of the task force stand. I think some of them are right. Please stand and let's acknowledge you. Thank you all very much. I could sleep soundly because they were there to work morning, afternoon, and evening and midnight. Thank you all very much. God bless you.
I think we ought to give the task force another round of applause. And then also thank CSOs, members of the Parliament Select Committee on Health. Also, we are told you did a good job on this. We also have members of the Ministry of Health, the Ghana Health Service, amongst others. And of course, I must also say that we are live everywhere. Ketsi, the Minister in charge of Government Communications, Felix Kwachiofosi, is also in our midst. At this point, we'd like to take remarks, brief remarks from carefully selected groupings. We will take, first off, from Professor Richard Adanu. He is a rector, Ghana College of Physicians and Surgeons. Please, let's welcome him warmly for a brief remark.
Your Excellency, President of Ghana, John Dramani Mahama, the Honorable Minister of Health, Kwabena Minta Kando, observing all the protocols that have been well established by the Minister of Health, I thank the organizers of this gathering, this historic event, for asking me to speak briefly. I'm here on behalf of the heads of agencies of the Ministry of Health, and especially on behalf of the rectors of the postgraduate specialist training colleges, to say that just like Reverend Professor Aite said, His Excellency has brought the baby out. He's created the legal environment for this Mahama Cares initiative, and the task now falls on us as heads of the agencies of the Ministry of Health to make sure that this works. So I'm here to say on behalf of all the heads of agencies that we are committed to making sure that this Mahama Cares initiative works and that Ghanaians feel the full benefit of this. I'm here especially representing the postgraduate medical colleges as we talk about this, because for this initiative to work, we need specialists to provide the leadership. And many people appreciate the work of specialist doctors and talk about that. But many of us are a bit blind to what specialist nurses and specialist pharmacists do. But then I would like to just let all of us know that we need specialist nurses, we need specialist pharmacists, and we need specialist doctors to make sure that this is delivered. This is not a thing that is done only by doctors, it's done by the whole healthcare force. And whatever is being done to make this initiative work should not selectively choose some members of the healthcare force. It should cover everybody equally. Having said that, I'll talk about what I know. We at the Ghana College of Physicians and Surgeons have done some analysis, and we've realized that we need about 6,500 additional specialists for us to be, of all categories, for us to be able to deliver the kind of care that is needed by 2030. Currently, we have about 2,000 specialists in training in the country. So there's quite a bit of a gap. However, mathematically, we can actually halve this gap if all regional hospitals in the country are fully delivering postgraduate training. And would like, Your Excellency, now that we have your ear, to ask you to lean on the Minister of Finance, and all other people involved to make sure that this is delivered during Mahama Chapter 2. We believe that it is possible in 4 years to have all the regional hospitals fully delivering a certain set of postgraduate programs. And if we do that, we can increase the number of specialists in training currently from 2,000 to 3,000. I mean, that's a 50% increase, and that would be very good. We would like to have all hospitals equipped with mini simulation centers. I mean, in other words, labs where they can go and practice on how to deliver their services and not necessarily practice straight on patients. And then, in addition to that, have 4 simulation centers over the whole country. We currently have 2. There's one here at UGMC, there's one at University of Health and Allied Sciences. And if we deliver 2 more, Your Excellency, we will fill this country with specialists. So I end by asking for the support of your government and your office to get this to happen. And have no doubt at all, we are fully committed to delivering this initiative. You have created the appropriate legal environment, and we are committed to working on this. Thank you.
Thank you very much, Professor Adanu. At this point, I would like to invite Corporate Ghana, of course, because of their immense contribution that we are expecting from them. I think that this applause should actually bring down the roof at this point. Please, ladies and gentlemen, let's welcome the corporate banking head for CalBank, Kwejo Arize. He would be actually speaking on behalf of Corporate Ghana. Kwejo Arize, please, let's do it once again for him.
Good morning, Your Excellency. Good morning. Good morning, our Minister for Health, and good morning, ladies and gentlemen. Good morning. All protocol is observed based on what has been said already. So I stand here representing Corporate Ghana, and we work with people. And I indicated that everybody here is an employee, with our chief employee sitting here. And if we don't take care of our people, we think that we're not going to be able to achieve our objectives as Corporate Ghana. This morning, I just want to draw the attention of Corporate Ghana to the need to support a healthcare that ensures that our objectives as an institution, whether in mining, in finance, in healthcare, in oil and gas, in whichever sector, is achieved. We can achieve that through working with people and ensuring that our people have good health care. We believe that the Ghana Medical Trust Fund is the right thing to support. It's the right policy to support. And we employing every corporate head, every institution to ensure we come to the party. This is not a one-time support requirement. This is supposed to be a lifelong activity that we all commit to. We can make it work if we all put our hands to the wheel. So I'm here calling on the support of all Corporate Ghana and everybody, every institution in and out of the country to put our hands to this to make it work. And I believe that with our over 14 million workforce from formal sectors, informal sectors, if we support this health policy, we can get the benefits, and the country will be a much wealthy country with a healthy people. Thank you.
Group Group Head, Corporate Banking, Kojo Ariza, thank you. And I see leadership of MTN here as well, so I'm sure that they're also committing to this. And if the applause you gave earlier for Kojo was not good enough, I'm sure you know it was not. It's time to hear from our development partners. And this time, I promise you're going to do it louder for them. Please, let's welcome the sector lead of the development partners in Ghana, the Chief of Health, UNICEF, Manuel Dewez. Is that all we can do?
Your Excellency, the President of the Republic of Ghana, John Dramani Mahama, Honorable Minister, heads of agencies and directors, members of parliament, distinguished guests, I'm standing on existing protocols. On behalf of the Health Development Partners, allow me to congratulate the Presidency, the government, and the Ministry of Health on the launch of the Ghana Medical Trust Fund initiative, a visionary step towards equitable healthcare and sustainable financing for the fight against non-communicable diseases. This initiative is in line with the vision of most health development partners who aim to ensure Ghanaians have access to quality healthcare services, including for NCDs. As you know, NCDs are a major public health challenge that undermines social and economic development and can increase inequities within populations. Today, as mentioned by the Honorable Minister, NCDs are the leading cause of deaths worldwide. Low and middle income countries are also affected. In Ghana, the share of NCDs in the disease burden is increasing, and this is mainly due to an aging population, rapid urbanization, and changing lifestyles. Most premature deaths from NCDs are largely preventable. Through the development of multi-sectoral public policies beyond the health sector to prevent exposure to key risk factors such as tobacco and alcohol abuse, and healthy diets and physical inactivity. Furthermore, there is a lot of evidence that supports the implementation of cost-effective preventive and curative intervention in health services. Strong leadership and urgent action are required to achieve this, and we commend the government and the Ministry of Health for their leadership. However, as always, sustainable financing remains a major challenge and requires innovative thinking, and we commend the uncapping of the NHIL for this purpose. The remarks by the Honorable Minister unveil important features about this important initiative, but we look forward to learning more. Health development partners stand ready to provide the necessary support to the Ministry of Health and its agencies to help save lives, improve the health of present and future generations, and ensure that the human, social, and financial burden of NCDs does not undermine the development progress made in Ghana in recent years. Thank you and congratulations once again for this transformative initiative.
Thank you, Manuel Dewez. Of course, if you mention MTN, you must mention Telecel. They are also represented here as well. At this point, it's time to bring it a bit more home. When we talk about chronic diseases, many think that it is associated with just the aged. But nowadays, more and more young persons are finding themselves hit with this particular situation. Most of them have been driven to poverty as a result of the situation. I have in our midst this morning a mother and a daughter who are both living with diabetes. Ladies and gentlemen, it's time to hear the story of Janet Ashibu. Please welcome her with a round of applause.
Madam Wasi, Mechia President Mahama, and in the chief Gifonina, any penny for Nina Muaha, Madam Wasi, Chiamu. Acho anopa so aye maniji ene mahowa ho ase mesumi na ha me a diabetic patient emri bebre atwemu no ye hunu se eye panyefo yare ana ne omu sika omu di srochi ena omu nya sa yare no but menim say ade a yare a ebetima aba nkola mu nsusu menya no ache kakra ba me protect me hu kakra se me sumetina se ache kakra yare a yare boni pa ekum ema we kura enwu but nyame adom igusu metina se nti dia me kan say sesia no ebi aba me ban susu a me gusu a me solve but enya yare a ebekọ ba ye be take care of nti dia me di ban say nyakopon emboye na intimi sum but ali kakra me kan say ye dro no eya ne boarding me a me gina ha no me a single parent e won kwala frame mintimi hwefie na ado nyakasa mato na mato amakwala no so eye di mame at times dey ebe di kura nyame na ebe mu nti me adis ready say ebe se omampani enya ho bua maye ma aduro no na yetimi nya do na yemfa keke yare we afi yesu do say enko bat ye be prevent ma dia oni bi no ono su benya aduro ni bi e dia preventing ho edanasi se Mahama Cares na odi bae no edanasi bebre se nyame nhira so na adwempa ayamaye se ofa bi ewo mu maye no embremu medamwasi.
That's the story of Janet Ashibu. The daughter is also here, but for obvious reasons, I cannot bring her up. I'll try to do a quick translation, except the Sochi part. But of course, she's hoping that Mahama Cares is here to stay. She highlights the situation she's faced with together with her daughter as a result of the sickness or the diabetes that they are having to live with. And they are hoping that there will be subsidies on medications for them and those living with that disease. Rather a touching story, but it's time to uplift ourselves because we know that there's a new era in chronic disease care, and that is in Mahama Cares. At this point, we've come to the time where we finally have the presidential launch of the Mahama Cares initiative, which is the Ghana Medical Trust Fund. I'll tell you something. Yesterday, Ejumara was launched. Today, Mahama Cares is being launched. Tomorrow, the National Apprenticeship Program will be launched. That's not all. Relax. On Thursday, we'll have the Black Star Experience launched. At this time, you can do the round of applause. It is now my distinct honor to respectfully invite the Ejumara, the Commander-in-Chief of the Ghana Armed Forces, the President of the Republic of Ghana, John Dramani Mahama. Please, shall we rise and give him a thunderous applause as he comes off stage to speak to Ghana.
Thank you very much. I mean, the remarks by our sister here, I mean, very touching. And maybe I'll make a few remarks before I inflict the official speech on you. And it mimics almost exactly what the minister said. But I want to say I can empathize with what she's going through because she's just one of many of our citizens and countrymen and women who are going through what she just talked about. And the perception was that if you were rich, it was a disease for the rich. Hypertension, cardiovascular diseases, diabetes were diseases of the rich. But increasingly, we see that it's inflicting more the persons who are much poorer and can least afford to be able to manage those diseases. And that's why the Ghana Medical Trust Fund has come at the right time. I have a personal connection to non-communicable diseases, and that is because my father died in 2001 and he died of prostate cancer. My mother died in 2016, and she died of complications of high blood pressure and diabetes. My stepmother died of breast cancer. I lost a friend and somebody who worked for me last year. We celebrated 1 year since she passed. I'm sure most of you know Mawena Dumo. She died of breast cancer. And currently, I have a staff in my office whose son is in his 30s and is on dialysis, is suffering kidney failure. And so these are not things that are far away from us. These are things that are close to us. These are loved ones that we're talking about. And so like Prof. Saite said, we must not see them as statistics. We must see them as real lives that we need to touch and help. But there's the even sadder story of one of my confidants and strong supporters when I started this whole political journey. He was an assemblyman, and he was an executive of our party in Bole Bamboi, where I started my political career as a member of parliament. Very close to me, went everywhere with me. Anytime I went back to the constituency, he was in charge of the southern zone, and so anywhere I went, he went with me. And a few years back, he started to have a problem with his kidneys. And so at the time, there was no dialysis north of Kumasi. And so if you had kidney failure anywhere above Kumasi, you had to travel to Kumasi to do dialysis. And so he used to travel from Bole Bamboi like once every week to do dialysis, go back, and the cost was unbearable. I tried to help as much as I could. Eventually, he needed more, a dialysis treatment, and so he couldn't be going and coming. So he had to move his whole family to stay in Kumasi, rent accommodation in Kumasi, so that he could be close to Comfort Noche, where he was undertaking the dialysis. Sold his motorbike, sold his TV. And much as I also tried to support, the cost was becoming unbearable. Eventually he died. And he died leaving poverty behind because he sold all his assets to be able to look after himself. And so we had to take care to support some of the children to be able to finish school and all that. These are real stories. And that is why what we're doing today is important, because it will touch a lot of lives and help a lot of our fellow citizens. But let me say that this program must be linked and will be linked to our primary health care project, which we are yet to launch. Because under the primary health care, we envisage that there will be volunteers and designated community pharmacies where our citizens, wherever they live, or the CHIPS compounds, will be required to go and take their blood pressure, check their sugar, because like was said by the UNICEF director, these diseases are preventable. And even if they have an onset, if you detect it early, you can have a favorable outcome if it's detected early. And so the primary health care would have community volunteers who will go from house to house occasionally, maybe every 3 months, every 6 months, and just take people's blood pressure, check their sugar level and all that. We'll have a program where women, are able to detect lumps earlier to be able to get treatment in case they are developing breast cancer, and so many of these other things. So I think there should be a linkage between Mahama Care and the primary health care program when we launch it. But more especially, a lot of these diseases are caused by ignorance in terms of our lifestyles and all that. And so we must also, as part of the Ghana Medical Trust Fund program, launch a very strong awareness campaign so that people will know what the trigger factors for these non-communicable diseases are. I understand that some of them are genetic, because you can inherit it from your parents in your genes. But a far greater number are lifestyle diseases. They are acquired. They are not genetic. And so if people just know, what their disposition is and they are able to make changes in their lifestyle, I'm sure that we should be able to bring down, the level of disease burden that we currently are seeing. I want to thank our brother from CalBank for the very good testament he made about the need for support by Corporate Ghana in this particular exercise. And I want to encourage Corporate Ghana, businesses, the mines, the banks, and all the other companies that this Ghana Medical Trust Fund program is coming. Those is coming to help are your clients who save their money in your banks. They are your clients who do business with you. And indeed, they are not only your clients, they are even your own staff. Some of your staff have died, from breast cancers and diabetes and all that. And so, as part of your CSR, if you give anything, you are giving it not just to help people, but to help your own clients and your own, your customers and your own staff. And so, I'd like to encourage all corporate Ghana, that is private sector and state sector, to annually devote a portion of their community social responsibility to Ghana Medical Trust Fund, because it's going to do a lot of good to our country. I want to assure Prof. Adanu that while he was speaking, the many suggestions he was throwing out, I turned quietly to the Minister of Health and asked, "Are you taking notes?" And he quickly took his paper and started writing. So, Prof, you can be sure that note has been taken of the suggestion you made, and we want to thank you for that. I want to thank Professor Aite, who's been my long-standing friend and mentor, for the contribution he made. Prof. Aite is a retired specialist, emeritus professor, and very well known in medical circles. And so when he gave the envelope, for a retired pensioned, medical professional, I was curious to see how much he had given. And so after I took the check, I gave it to the health minister. But after a while, I collected the envelope back, and I peeked at it. And he won't want me to mention it, but I want to say that I was surprised at how much he's giving. Society, a doctor on pension has given $1,000 to Ghana Medical Trust. And so that should encourage all of us and encourage, the corporate institutions to do even much better. But on that note, I also, as the initiator of this laudable program, would also have to give something. And so I've pledged half a year, 6 months of my salary to Mahama Cares. I'm not yet being paid. They say Accountant General is still doing something. But whenever Accountant General finishes, 6 months of whatever I'm entitled to will go into Mahama Cares. So I thank you very much. Now let me inflict my speech on you. Mercifully, it's short, so you won't have to live through too much pain. Yeah. So I am deeply honored to join you this morning for the official launch of the Ghana Medical Trust Fund, Mahama Cares, as it's called, a landmark initiative introduced by my government to decisively confront the growing burden of chronic non-communicable diseases, for short NCDs. The fight against NCDs is intrinsically linked to our broader national development agenda, particularly the Sustainable Development Goals, and most notably SDG 3, which enjoins us to ensure healthy lives and promote well-being for all at all ages. Specifically under SDG 3, Target 3.4, commits the global community to reduce premature mortality from NCDs by 1/3 by 2030 through prevention, treatment, and promotion of mental health and well-being. Across the globe, non-communicable diseases, including cardiovascular diseases, cancers, chronic respiratory conditions, diabetes, and mental health disorders, remain the leading cause of mortality, accounting for over 43 million deaths annually worldwide. Worryingly, the burden is disproportionately borne by low and middle income countries such as ours, posing not only a public health crisis, but also a profound social and economic threat. Non-communicable diseases exacerbate poverty, they widen social inequality, and undermine economic development. Vulnerable populations, that is those with lower education, limited access to healthcare, and lower income levels, are currently most at risk. Addressing the NCD menace is therefore not merely a health imperative, it is essential for advancing economic growth, promoting social justice, and securing environmental sustainability. In Ghana, the picture is equally alarming. Available data indicates that NCDs amount for over 40% of all age category mortalities, and they consistently rank among the top 10 causes of death nationwide. Even more disturbing is the steep rise in hospitalized cancer cases, which jumped from 3,487 patients in 2012 to 16,105 in 2016. Alarmingly, adults aged from 18 to 45, the prime of our nation's workforce, account for more than half of these cases, 16,000 cases. This troubling trend is driven by a convergence of factors. One, shifting lifestyles characterized by things like tobacco use, alcohol abuse, unhealthy diets, and sedentary behavior, and also increased environmental factors. The cost of treatment, ladies and gentlemen, is not just disturbing, it can be devastating for low-income families. Estimates from our teaching hospitals reveal that the average annual cost of non-communicable disease treatment per patient averagely stands at approximately 53,000 Ghana cedis annually, and that's equivalent to about $3,300 US. Managing chronic conditions imposes crushing financial burdens on families, often pushing them below the poverty line and deepening their vulnerability. It is estimated that individuals diagnosed with chronic diseases face a 75% likelihood of falling into poverty within 5 years, regardless of their original economic standing. And so it even ruins rich people. I mean, you spend all your money trying to find a cure. Those battling kidney and cardiovascular diseases are reported to spend between 70% and 95% of their non-food expenditure on healthcare alone. Older adults living with chronic conditions spend 5 times more on healthcare than their healthier counterparts. Despite the important strides made through the National Health Insurance Scheme, it remains inadequate in fully covering NCD-related services and medications. In 2018, around 48% of all NHIS claims were related to non-communicable diseases. Yet essential services remain outside the NHIS coverage, leaving families dangerously exposed to out-of-pocket payments. It is against this background that shortly after my election as President, I directed the Honorable Minister for Health to initiate the establishment of the Ghana Medical Trust Fund, a commitment captured faithfully in the 2024 People's Manifesto of the National Democratic Congress. Following extensive consultations with inputs from over 3,300 stakeholders, the national task force I formed, ably chaired by Reverend Emeritus Professor Seth Aite, submitted its final report on April 10th this year. I'm pleased to inform you that the accompanying draft bill, as the Minister said, is ready and will be presented to Parliament when it resumes at the end of next month. Ladies and gentlemen, today we're launching more than just an initiative. We're launching hope. Hope for thousands of Ghanaians living with chronic diseases. Hope for families battling the overwhelming costs of care. Hope for a future where the quality of life is not determined by one's ability to pay for essential treatment necessary. The Ghana Medical Trust Fund will support specialist-level treatment for a range of chronic diseases, including cancers, diabetes, cardiovascular diseases, chronic kidney failure, stroke, and other complications. It will also progressively expand to cover convalescent care, palliative services, and home-based support. Support from the fund will be based on formal applications, carefully vetted, and will focus on costs not currently covered under the NHIS. The fund will operate as an independent statutory trust, governed by a board of trustees and supported by a dedicated administrative secretariat, third-party administrators, and patient navigators to ensure transparency, efficiency, and a patient-centered service ethic. Initial projections suggest the fund will require approximately 3 billion Ghana cedis annually over the first 3 years. And as was said, the main source of finance is going to come from the NHIL, the uncapped portion of the NHIL. It will also include direct budgetary support from government, voluntary contributions from corporate institutions and individuals, grants, donations, and will also be able to invest in order to raise income, investment income. Strategic procurement measures such as access pricing and framework contracting will ensure that essential medicines and diagnosis are acquired sustainably. And so I spoke to the minister and asked if we couldn't encourage our local pharmaceutical industries to increase the availability of generic drugs, which are much cheaper than the imported drugs. I know because I paid for my mother's diabetes drugs, and I know the difference between the imported drugs and the difference in cost. And so if we can encourage our pharmaceutical industry to produce generic versions of those drugs, it will bring the costs much lower. I wish to commend the exceptional leadership of the National Technical Task Force, chaired by Reverend Emeritus Prof. Seth Aite, and to extend my heartfelt gratitude to all the professional associations, religious leaders, our development partners, and citizens who contributed their expertise and passion to bring this initiative to life. Your dedication has translated a manifesto promise into a tangible, life-changing reality. On that inspiring note, distinguished ladies and gentlemen, I'm proud to officially declare, is there going to be a fanfare? Let me know. The last time when I was just declaring something launched, then I almost ran away from the stage. Okay, there's no fanfare. All right. On that inspiring note, distinguished ladies and gentlemen, I'm proud to officially declare the Ghana Medical Trust Fund, into brackets Mahama Cares, duly launched. May God richly bless all of us, and may God continue to bless our homeland, Ghana. Thank you very much.
Thank you very much, Your Excellency. Well, there's no papa. Please, you can take your seat. But we've got $1,000. We have 6 months' salary promised. Do we have any takers? Maybe. I think it's a good time to do a mini fundraiser. It's not part of the program, but with your permission, Your Excellency, Do we have any takers, or you want to give in on the quiet? I'm looking at. I've seen Alaji say Dragongo. Okay. Please, I want to hear it in the microphone. Well, so his boss has given 6 months of his salary. He can't go beyond his boss, so he will do 3 months. Thankfully, there are 3 ministers.
We also cannot go above the Minister for Health. And so, as police, the 3 of us here, we are doing a month each. Thank you very much.
Well, we have the Vice President's Chief of Staff here. We have the Deputy Chief of Staff outside. We have the Secretary to the President. And I see Corporate Ghana. I see CalBank. I see MTN. I see Telecel. I see NHIA boss. I see Ghana Health Service Director General. The task force, you are exempt because you've given a gift. But if you are willing to also do it, you can do so. I see the rector, physicians and surgeons also here. So any takers? Let's do this quickly. The president has to leave us. Any takers? Oh, I should see you. Okay, I see a young lady. How much, please? Let me write. Who is taking notes for me?